An exposure to pollens, grasses, dust, and other airborne allergens result in our eyes looking reddish, tearing, swelling, and itchy. This condition is described as an allergic conjunctivitis. It is usually seen in children after playing outside and is more common during winter season, often described as seasonal allergic conjunctivitis. The pollen, dust, grass, and animal dandruffs, etc., are known as allergens and are responsible for causing the allergic conjunctivitis. Therefore, allergic conjunctivitis can be defined as an inflammation of the conjunctiva due to conjunctival reaction to an environmental allergen. Major signs. The four major signs of allergic conjunctivitis are hyperemia or redness of the eye, lid edema or swelling of the lid, watery discharge or clear discharge, and chemosis or swelling of the conjunctiva. I know you can think of all these signs are similar to that of viral conjunctivitis, right? So be patient. The main difference is what we are heading to now. Major symptoms. The first symptoms is intense itching or feeling of an ache throughout the eye. This is because allergens like pollen or any other allergens causes the release of histamine from the mast cell of conjunctiva, resulting in intense itching. So it is the histamine that is causing the intense itching. This can be noticed in patients rubbing his eyes after every interval of time. Therefore, the main symptoms or sign identifying allergic conjunctivitis is intense itching. The second symptoms is photophobia or fear of light, which is similar to that of viral conjunctivitis. I guess you should watch our video on viral conjunctivitis. The link is in the description below this video. The first treatment for allergic conjunctivitis is the removal of the allergen from the eye. The second is by the use of an antihistamine medication such as loratadine, used purposely to relieve the itching. The third is by using mast cell stabilizer drugs such as cromolyn sodium ophthalmic and eye drop, used mainly to stabilize the mast cell of the conjunctiva to reduce production of the histamine that causes itching. The treatment can also be achieved simply by using dual-action antihistamine and mast cell stabilizer drug, such as ketotropin eye drop. This kind of drug does two actions. The first is that it blocks the receptors for histamine, thereby the released histamine cannot cause itching. And the second is that it prevents mast cell from producing additional histamine to cause itching. Likewise, topical steroids such as dexamethasone can be prescribed, and cold compresses and artificial tears are applied for symptomatic relief, just as in viral conjunctivitis. Preventions. Preventive measures for allergic conjunctivitis can simply be achieved by just avoiding the allergens. For example, if it's due to dust or any other airborne allergens, you can just wear or use safety glasses to protect your eyes. And if it's due to pollen, you can shut your doors and windows of your house or use nets while at home to prevent such pollens from reaching you. While you're outside, avoid approaching trees and grasses suspected to produce such pollens. Don't forget to like, subscribe, and share this video to protect others from being at risk of allergic conjunctivitis, especially your loved ones. See you next time.